If you are breastfeeding, you may have heard about clogged ducts or you may experienced them. And there's new evidence out there that shows that clogged ducts and mastitis are caused by an inflammatory response. Hi, I'm Dr. Ryan Bailey. I'm a pelvic physical therapist and I specialize in pregnancy and postpartum. And today I want to go over new guidelines on how to treat mastitis, as well as show you what I've been doing with my patients for years, as well as used for myself. So the new guidelines are based on this inflammatory response, and what we want to do is we want to reduce the inflammation to allow the milk to flow again. So what they have found is, instead of having nice broad milk ducts that allow the milk to come through, there's this inflammatory response, and there are risk factors that increase your chances of getting a clogged duct. And I have linked the article below so that you can read more about that. But what happens is the ducts then get compressed down from inflammation around it, and so it makes it a lot harder for that milk to flow through. What they now say that should happen is, instead of doing a warm compress and vibration or more aggressive massage to move the clog through, we actually want to treat the inflammation. And you can treat the inflammation both at a systemic as well as a local level. And so the things that they suggest are using anti-inflammatory medication, feeding on demand rather than doing extra pumping, because you don't want to create more milk, which may cause more pain. You also can use cold compresses, and this is something I'm going to talk about a little bit later. You also want to do some very gentle massage. And then the last thing is you want to do some preventative measures. So taking either probiotics or sunflower lecithin can help with the more systemic inflammatory response. Now, I do massage with my patients. However, I have not recommended cold as readily as these guidelines do, and that is because cold is not necessarily the top choice for inflammation, based on lack of evidence, as well as we now have other information that shows that doing massage or other things actually reduces inflammation more than cold. However, if you feel that the cold is helping with the pain management, then keep using it. So what I want to do is I want to show you the massage that I teach my patients, and it's based on the lymphatic system and how we want to move the inflammation out of the breast tissue. So what you want to actually start off doing is priming the lymphatic system, and that includes where we have the largest amounts of lymph nodes. Now, there is many ways out there now that say this is how you prime or open up the lymphatic system. This is how I was taught in my training on how to open up the lymphatic system. And I start at the collarbone or the clavicle, okay? So we have a large amount of lymph nodes in this area. And what we want to do is we want to open them and close them, creating this pumping action that tells the system, hey, we're going to be processing more fluid. So what I do with my hands, and you can be sitting, lying down in a comfortable position, I'm just upright so you can see it better, is place your hands. I like placing them in this cross pattern because it drops my fingers right where I want to be doing this massage. Now, this massage is not a typical style massage. This massage is actually just a pull of the skin, and I am not pressing down into the skin. I am just resting on the skin. Then what I do is I gently pull the skin towards my breastbone, hold for 3 seconds, and then let go for 3 seconds. So I'm gonna pull for 3 seconds and release for 3 seconds. Last time, pull for 3 seconds and release for 3 seconds. So that is a pull for 3 seconds, release for 3 seconds, 3 times. Then from there, you move on to the armpit, okay? The armpits are another place that have high levels of lymph nodes. So we want to do the same exact thing. From the armpit, ideally on your skin, you're gonna pull your skin towards your breastbone, and then you're going to release. And we're gonna repeat that. Pull for 3 seconds, release for 3 seconds. Pull for 3 seconds, release for 3 seconds. And then we're gonna repeat that on the opposite side. So once you have then primed your system, just in the upper portions of the lymphatics, then you want to start to help your body direct the inflammation towards the area that has the higher portion of lymph nodes. So if it is your left breast, you want to direct towards your left armpit. If it is your right breast, then you want to direct towards your right armpit. To do this, you want to be thinking about moving or opening up from the lymph nodes towards the clog, okay? And so you actually start off over by the armpit, and then you gently pull the skin towards the armpit and then move towards the clog. Move towards the armpit, release, and then move the hand. So I am pulling my skin. Ideally, you're doing this on skin. I'm pulling my skin towards the armpit. I'm not kneading. I'm just pulling. Pull, release. Pull, release. So if the clog is more on the inside of the breast, you would work all the way towards there. If it's more on the outer side, you may not need to move very far. If it's at the top or the bottom, anywhere, that is the direction that you are going. Then what you can do is from the clog, you can gently do sweeps, okay? So this is just a effleurage style massage where you aren't actually pressing into the muscle. You are just stroking the skin from where the clog is towards the armpit, releasing and then repeating. Okay, so the steps are open up your lymphatic system. So we want to start at the clavicle, we want to go to the armpits. You can also include at the groin as well to get a whole system online. But if you don't have time for that, or if you notice that, you know what, if I just do here and here, that is enough, then you can remove that step. Then what you want to do is you want to teach your body that we need to move it towards the armpit. And so you're going to start at the armpit and gently pull the skin in that direction, moving towards where the clog is. Then you are going to do your sweeps towards that armpit. Okay? So to support that massage, you may also want to introduce the use of kinesiotape. I'm going to do a different video that shows you how to use kinesiotape to support the movement of the fluid towards your armpit. And it also helps potentially the reduction of pain because of how kinesiotape works. Drop your questions in the comments and don't forget to subscribe so that you don't miss any of these videos on how to support your body in postpartum.